Hi, everyone. Welcome to this Lunch and Learn with the National Center for Civil and Human Rights. My name is Shelly Anand. I'm going to be moderating our discussion today. I am a supervising staff attorney with Tahirih Justice Center's Atlanta office. Tahirih provides legal and social services for immigrant victims of gender-based violence. And just by way of background, prior to my time at Tahirih, I did immigrant labor rights cases with the U.S. Department of Labor, and I was a legal aid attorney with Georgia Legal Services representing undocumented victims of domestic violence. And we were just talking about our how close-knit our immigrant rights community is here, and how our panelists and myself have known each other for several years and know a lot of the same people. So today should be kind of a fun, informal kind of conversation. The purpose of our panel today is, we're all sitting at home, quarantined with the coronavirus. All over the world, we're seeing how the coronavirus pandemic is impacting various communities here in the US. We know healthcare workers are risking their lives as they try to save lives. We know that legislation has passed to provide unemployment and paid leave to workers who need it. And we know that this virus is disproportionately impacting some of the most marginalized communities, including the African American community. And so this virus, this pandemic, is really shining a light on systemic and institutionalized inequalities such as racism and xenophobia and things of that nature. Today, we're going to be talking about the immigrant community and how this pandemic is impacting this vulnerable population. And when we talk about the immigrant community, we mean everyone. So from folks that have status here, who are H-2A workers working in our fields as farm workers, and they're considered essential workers, picking produce that we're going to the grocery store to buy every 2 to 3 weeks and wiping down. What protections are they having, if any? To immigrants who are awaiting their immigration status to be adjudicated in immigration courts, to asylum seekers at the border. So here with us to talk about this important topic are two well-known and respected advocates and activists in the immigrant rights community. We have Gigi Pedraza, who is the executive director of the Latino Community Fund in Georgia. She's a longtime advocate and activist for the Latinx community, and has, done so much for the community in starting the LCF. And then we have Monica Khant, who is the executive director of the Georgia Asylum and Immigration Network, which provides legal services to immigrants who are seeking status in this country. So I'm going to have both of them just quickly introduce themselves and talk a little bit about the organizations they work for, and then we'll get started. So Gigi, do you want to quickly give an intro about LCF and what you do?
Sure. Thank you, Shelly, and really a pleasure to be here with you all today. The Latino Community Fund is a nonprofit organization that has a foot in the philanthropic space and a foot in the nonprofit space. We have over 35 member organizations, all Latino-led, Latino serving, and Latino governed, 2 out of 3 at least, simply because we believe that our community, our own people, are uniquely qualified to serve, design, and develop, programs and efforts that are going to really push the community forward and accelerate their path, not only to survival, but to thrive. We provide advocacy, civic participation education, capacity building program development to our member organizations and partner organizations. And we also provide grants. For COVID-19, we have an emergency fund that we have developed. We have raised around $200,000, and 95% of those funds have already been dispersed and committed to our communities. And we're prioritizing undocumented communities in Georgia that are left behind from all the stimulus package. So that's us. We're all Latino-led, Latino governed, Latino serving, of course, and majority women-led and governed too, like
Awesome.
this panel.
Wonderful. Monica, could you give a quick intro about GAIN?
Absolutely. And thank you for having us today, Gigi. I'm so excited to be on this panel with you. And Shelly, it's great to have you as our moderator. And thank you to the National Center for Civil and Human Rights for really focusing on this issue. It's very timely, and it's something that we all care about. I think you all care about it too, which is why you're on this webinar with us. So let me tell you a little bit about GAIN. GAIN started in 2005 with the law firms here in Atlanta, Georgia. We provide pro bono legal services to immigrant victims of crime, persecution, domestic violence, and human trafficking. And so when we started in 2005, it really was a, small project. It was really for the, legal community to, dip their toes in and take immigrant asylum cases pro bono. But what started in 2005 was a real movement, and we learned that the law firms here in Atlanta were very interested in making sure that immigrants who were in court or had hearings had legal representation, because they were not provided an attorney, unless they could afford one or pay for one. And so when we started our flagship program with the Asylum program, and then in 2010 we added our Victims of Violence program, which provides the same level of care, legal representation to human trafficking victims, domestic violence victims, sexual assault, and other crimes. And so our model is to mentor, supervise, train, and recruit volunteer attorneys so that when they represent our cases, they feel like they have a safety net, and then they can go ahead and properly, represent our cases with, someone to turn to for technical assistance and, questions while they're representing our cases. Last year, we represented over 600, clients. And, we are constantly, even more so now, there for our attorneys and our clients who need us, during this crisis. And I know we're going to talk about that today. And I look forward to adding our perspective on it.
Great. Well, thank you both so much for giving our attendees an overview of the two organizations that you've been working for such a long time. I want to start by kind of asking both of you about kind of some of the overall themes of what you are seeing immigrants struggle with during this pandemic. I mean, we are all facing so much from, schools being closed and, school-age children now being at home, to food security, to, the industries that a lot of our populations that we work in, from farm workers to the service industry. How is this pandemic impacting these communities? So Monica, I wanted to start with you. Can you just kind of overall in the last month since we've gone on, lockdown with this quarantine, what are some of the calls you're getting about what your clients are facing?
Yeah. Thank you, Shelly, for asking that. That's a great question to start off with, because I would say that our clients are facing everything that you hear about, in the news, with those who do have status in the US, but even more, even more intensely, and they're even more vulnerable than, everybody here in the United States. And, Gigi and I were talking earlier, and I know that she has some, cases that she's heard of, but at GAIN, what we've heard of is the same insecurity with housing, with food, with services, for clients. Our clients need them just as much. However, with that said, they're already in vulnerable situations. Many of our clients may not be living in, a rental, a home where they have like a rental agency and, some of the the usual rules and regulations in place. So what's been happening is our clients, if they're subletting or leasing from a private owner, they're more vulnerable to, you know, being told, if you can't pay your rent, you have to leave. And many of our clients are working those jobs in the food industry, in the, you know, service industry that has been heavily impacted by what is going on right now. And so every day we're getting calls on our clients needing assistance because of their situation being so unstable and having even less of an opportunity to ask for assistance.
Thank you for sharing that. Gigi, what about you? What have you been hearing with the communities you work with at the Latino Community Foundation?
So, you know, we work with a network of organizations that are in the front lines, really supporting families in crisis. We do not provide emergency direct services to people, but in spite of that, we have been receiving around 40 calls per day of people simply asking, where can they find food? What are they going to do if they are unable to meet their rent payment? This morning, I got a call of a man saying that, you know, it's just him and his 4 kids, and he was selling tacos during the weekend in Gainesville just to support them, but now he can't. And so how is he supposed to take care of his kids, pay rent, buy food? And so really the stories are terrible. We know in South Georgia, you know, 2 poultry plants have closed. Well, there are a lot more poultry plants that are still open. And we know specifically of cases of people, you know, showing COVID-19 symptoms for days without being able to afford sick days, or even have confidence of finding a place where they can get a test for free. Because if you all know, the eligibility under the CARES Act for free testing is Medicaid eligibility. And so a lot of our friends don't qualify. Even friends in Georgia that are green card holders and have had a green card for less than 5 years, they still don't qualify for Medicaid eligibility. So those are some of the stories, some of the needs. Diapers, formula, everything.
Right. We had a client who gave birth during the quarantine and, you know, trying to figure out getting her food and getting her formula. I guess another question I have, you both talked about rent. You know, some cities have put a moratorium on eviction and things of that nature. Is that something that your clients or the communities you're working with feel that they can enforce, or do they know about kind of some of these protections that city governments are putting in place?
Right. So, you know, our clients, you know, like I mentioned, are in vulnerable situations, right? And so they may not be, you know, able to enforce some of those new policies or some of what's, you know, those dictates are that have been coming down. They may, even if they know of it, they don't feel like they can because of fear of deportation or fear of exposure. You know, in any crisis situation, many of our clients, you know, are afraid to ask for assistance. You know, when we had, you know, the change in presidency a few years ago, domestic violence victims and human trafficking victims were not reporting. They were not coming forward. Even now, we've heard so many articles, you know, and news stories about that population in even a more desperate situation, even in a more crisis situation. And so we know that our clients feel like they don't have the support or the force to go ahead and make sure that they can, you know, fight for their rights, if you will, right now during these times with housing security. And Gigi, I'm sure you're hearing the same story.
Yeah, I think that, you know, you're absolutely right, Monica. In addition to that, there is another layer of complexity, which is, well, there may be a suspension on evictions or a moratorium. It doesn't mean that people don't have to pay rent at the end of the moratorium. So how are people supposed to get income if they are not allowed to work? Or, you know, the little money that they can still bring in, if they are considered essential workers, it's gone to feed their children or, you know, to pay for, you know, other needs. So, you know, one of our member organizations, Vecinos of Before Highway, for example, they have a program. We are providing some support to do partial rental assistance. They are writing, you know, partial rent for the landlords, $200, in addition to help them draft, help them bring a letter showing an intention to remain in the apartment, but noting that they are unable to meet the entirety of the payment and requesting a payment plan. So there is the immediate, you know, relief, there is a mitigation, but then there is going to be a recovery process that's going to be extremely long. And, you know, it is important though to focus on rental assistance, because if not, these families that are not able to get any other safety programs, TANF money or the stimulus payment, are going to be homeless.
That's right.
Right. So that, I mean, that kind of brings me to my next question. You know, with all this federal legislation that has been passed for workers across the country who are having to be laid off and seek unemployment, and, you know, ways for them to get unemployment, that has excluded, you know, many, of course, undocumented immigrants. How, you know, how is this impacting, you know, what alternatives do your clients and the communities you work with have, since this federal legislation with respect to unemployment at least doesn't protect them?
So, you know, they don't qualify for the stimulus package. They also don't qualify for unemployment. A lot of our workers don't qualify, and they don't get sick leaves because this is a cash economy that they, you know, live in. These are only cash transactions. They do not have any safety net whatsoever, you know, at the local, state, or federal level. There's just nothing. This is why we're focusing on you know, on raising dollars. I mean, but the reality is that, you know, it's going to be really impossible for the philanthropic or nonprofit community to completely replace the role of a safety net that the government should have. I was running some numbers this morning, and if, you know, we estimate that there are 300,000 undocumented individuals in Georgia, right? It's around 500,000 that are living mixed status families that also, by the way, don't qualify for the CARES Act, right? So, you know, for the stimulus check. So let's say 300,000, let's say most of them are parents, undocumented parents of families. If we were to provide a $100 check to 1/4 of those families, that's a $4 million investment that we would have to make only in Metro Atlanta. So it's just to give an idea, $100 per family, one time, 1/5 of families.
Right.
This is to give you an idea of the magnitude of the challenge that we are dealing with.
Absolutely. And at GAIN, you know, as I mentioned, we provide legal services, but the calls we've been receiving have been about other services as well, because of the need so great that those calls have increased threefold at our organization. And many of our clients, you know, even if we tell them, okay, you know, United Way Community Foundation has given money to a few $100,000 to some of, you know, our partnering organizations. That's been, you know, pretty much dedicated and used up pretty quickly, right? Gigi, you were mentioning that earlier on. And so we've referred some of our clients to this, but there's nothing, you know, there's, you know, no assistance there for them either. And so what we're doing at GAIN is this is not something that we've done before, because we usually partner with other agencies for this, but we're coming up with our own client emergency fund and seeing where we can also fill in just a little bit, even if it is that $100, and it may not, you know, help tremendously, but we can't not do anything during this time. We have to. And so we've opened up a client emergency fund and are really trying to fundraise for that purpose, you know, because it's a necessity. It's an absolute necessity, because that's the overwhelming amount of calls that we're getting from our clients who are requesting information on that.
Right. And I just, while both of you were talking, I mean, the three of us work with, you know, the undocumented community, and I'm sure just like, you know, we hear in the news and we hear in kind of some of the rhetoric around this community, well, why, you know, they don't have status. Why should we care? Like, things of that nature. I mean, we know for a fact that this population is a tax-paying population. And so what kind of, in terms of policy and things of that nature that you think, could help this population? I know that there's some politicians and policymakers that are interested in that. What do you think in terms of how this population's been ignored, despite the fact that they are contributing to this economy and are a vital part of the economy?
So we know that around 75% of all agricultural workers are undocumented in Georgia, had probably a short visa, a visa for a short time, stayed. Our economy as a state, as a country, relies and rests on the shoulders of these workers. If you like chicken, if you like vegetables, if you like fruits, if you have a rug, a carpet in your home, likely that was made by an undocumented worker. Not only that, caregiving services. Who do you think is cleaning the hospitals? Who's picking up the trash, right? So it's interesting because it's the irony of being essential, yet we don't provide the essential, services to these individuals. So I was looking this morning, somebody said, well, they call us essential because calling us sacrificial would be too honest. And I agree with that. So yes, they are tax-paying individuals. They're also human beings that deserve to eat and have a roof over their heads.
Yeah.
And my last point would be that people sometimes forget, particularly in Georgia, 90% of children of these undocumented immigrants are American citizens. So these are American citizens directly being affected.
Thank you for that, Gigi. I completely 100% agree with you. I had chills because you said exactly what I would have wanted to say, and I do say. And I think, these, just to, the only thing, the tiny thing I want to add is these are, this is a community that we depend on. These are essential workers. They have been deemed essential workers from our government, and we depend on them. Right now, we're, in isolation in our homes. The only time we can go out is when we need to grocery shop and we're getting what we need. These are the essential workers that are providing that to us. I think one of the most famous quotes that have come out in all this is, undocumented worker who is picking strawberries, and he says, I can't pick strawberries by Zoom. I'm still going in. I think we've all heard that quote because it's been, quoted a lot these past few days. And yeah, when I go to the store, I'm getting strawberries, for my children, for, my parents who I'm shopping for right now. And so you're exactly right, Gigi.
And you guys both brought up, farm workers. And so they're folks that come in on the H-2A visa, but end up, staying, coming out of status and staying to continue to work and provide for themselves and their families. I mean, we have a client in South Georgia, Tahare, who she's in the fields every day, picking produce, picking vegetables. And yet, she was one of the folks that called us and said, I'm picking food all day, but I don't have food to feed my daughter. And so I wanted to ask you guys about that particular population. March was Farm Worker Month, which is when farm workers across the country travel around the country to raise awareness around some of the inequalities and inequities that farm workers face, from not getting paid fair wages to health, OSHA violations, health and safety issues. What protections are farm workers given right now during the coronavirus? Do they have masks? They're in the fields? Is there social distancing? I mean, what are we doing as a society to protect these essential workers?
Go ahead, Monica.
No, I was going to actually toss it to you because you told me a really compelling story about a case that you had received notice on, from one of, someone who had reached out to you. But I want to just give you a short answer saying, I don't think we're doing much to protect these workers. And Gigi, you had a, actual story about this too. I don't know if that was what you were going to talk about, but it touched my heart when you did.
Yes. So, I cannot provide an answer specific to every single, group of farm workers because I am not based in South Georgia at the moment. I can tell you that farm workers never have protections. This is not just during this time. It's well known that, Emory Farm Workers Project, has to go there to give them boots, because they are not provided with boots and they are working with pesticides all day. Farm workers don't have access to fresh fruits and vegetables that they pick, like you just mentioned, Shelly. They don't have access to fresh water throughout the year. So this is not unique to COVID-19, or nothing that we are talking is actually unique, specific to this time. It's just exacerbated during COVID-19, Corona times. The story that Monica mentioned, it's this young woman that started working at a poultry farm. It's also the daughter of migrant workers that, she has tested positive for COVID-19. The line where she worked was closed, but not the plant. None of the other farm workers or agricultural workers have been provided information that she tested positive, and she is quarantined with her family, who's undocumented. There are siblings and a mom, and we are trying to get in touch with her and to ask the family to come forward and share their story to bring change, but they are also afraid. And so that's the story that I believe Monica was referring to,
Right.
but it's just one of many.
That's exactly right. And, labor trafficking has been something that we've been working on for many years. I mean, decades. But, at GAIN, we've been working with other organizations such as Tapestry and, CJCC, the Criminal Justice Coordinating Council, is very interested in this issue. And I would just say in the past 5 years, have we really pushed it forward as an issue here in Georgia? But it's been an issue that's been happening for many, many, many years. And so labor trafficking, yes, we're talking about it now because of COVID-19, but it's not just because of COVID-19. They've never, ever had the ability to, advocate for themselves or, out of fear of losing their, jobs. And, it's in rural Georgia where they have less access to any resources that maybe could potentially help them, here in Atlanta, where there are a few more organizations and resources. So they've always been a marginalized community and a forgotten community. And it's one that we depend on, very much so.
Right. I want to talk briefly about, under this administration, there's been so much focus on the border, right? We have the border wall, but then we also have what's come to be known as MPP, which is where asylum seekers are being stopped at the border and aren't permitted to cross over, and they have to wait for their immigration hearings on their asylum cases in Mexico. And so we had a group, both the center, the National Center for Civil and Human Rights, and Tahare took some pro bonos and supporters to the border. And really what you see there is refugee camps that the United States has created. And now with COVID-19, that kind of border, that kind of wall we've created with MPP is even more vulnerable. Can you talk about kind of what's happening at the border and how this situation has become even more exacerbated because of COVID-19?
That's for Monica.
Oh, so yeah, the detention issue right now is, even for me, one of the first, and foremost issues that to me breed vulnerability. Because, with anytime you're detaining a full group of people, and, for the last 2 years, we've been talking about detention at the border, but even now it's heightened when you have so many children, so many women, so many families stuck together in close quarters. And you can bet that even before, a lot of resources, blankets, food, whatever was needed was not even being provided. And absolutely right now, we've heard the same thing. We've also heard of, more, people being deported back. We just recently heard of a group of 400 children being deported. And where are they going to? Probably to, camps in Mexico. So, I think even with the policies before COVID-19, like, seek asylum in Mexico, don't, seek asylum in the first country that you pass through, that was already putting pressure on these detention facilities, but even now more so. When you have detention facilities in close quarters and children just being, held together without, social distancing that we're doing, but that's being, not even followed over there, it's even more in a crisis mode. And right now, again, another forgotten community. I don't know if anyone is really talking about what is happening at the border. So just anything is, happening there as well. But I also want to say, yes, we're, a lot is happening at the border, but the same thing is happening here within our states, within Georgia. We have detention facilities here. We have, right now, we were just talking about this, one of the largest detention facilities in Lumpkin, Georgia, called Stewart Detention Center, where we've heard of, a few guards, testing positive, and a few, immigrants who are being held there being tested positive. And so, and things are not easing up there either. They're not releasing some folks with minimal, crimes, even if that. And they're just being held in, one place without any policies or regulations from what we hear, happening. And so anytime someone can maybe be released under parole, it's because over there they have a medical reason to be, like maybe an at-risk community, someone who has diabetes, somebody who has a condition that they could be more susceptible to catching and passing away from COVID. So that's, a lot of uncertainty and turmoil, and already a, climate that there's already been a lot of. Gigi, would you like to add anything to what I've said from what you've heard as well from, folks calling you?
Yeah, I think the only thing I would like to add is that, family separation does not only happen at the border. It happens every time someone is detained and placed in deportation proceedings. Oftentimes it's breadwinners, and it happens all the time in our families. ICE enforcement in Georgia is rampant because of the 287G program that so many counties have, particularly Gwinnett County, Cobb County, Hall County, which are the counties that have high density of immigrants. So family separation and the consequences of it, the devastating consequences of it long-term, right, through generations, because these are children that are grown without food. We have enough, support, knowing that, the parent didn't leave them, but it was taken away from them. This happens all the time, and it's not just at the border.
Just so you brought up 287G. I know for a lot of us practitioners, that's been a section that we've known about for a while. Can you just briefly explain what 287G is for folks listening in that might not know our alphabet soup?
Sure. I mean, I'll give the general description, and of course the attorneys can correct me with all the details. 287G is an optional program that, counties can opt in, and it provides really discretionary powers to law enforcement to collaborate with ICE. So for example, in Gwinnett, in Cobb County, particularly in Gwinnett, I'll speak, if someone gets stopped for whatever reason, broken tail light, run over a stop sign, if that person is a foreign born, is fingerprinted and put in the county jail, and for 48 hours, ICE can come and decide if they want to detain them, and then that person is taken to a detention center without having to do anything wrong, unless you think, running a stop sign or having a broken taillight or not putting a sign, to turn left or right is a terrible crime. So that's how it is, and particularly Gwinnett County is responsible for over 20% of the entire country interactions with ICE. So that's my understanding of the program.
No, you're right.
Yes,
that's right. And that hasn't
not
stopped.
funded. It's also not funded, so it costs us.
Yeah. Mm-hmm.
And we know some, you know, Georgia has an anti-sanctuary city law. But this really, I mean, I know some localities, like here in Decatur where I live, there was an ordinance passed that said, hey, ICE, you need to have a warrant before we'll do anything to detain someone. And that there's been a lot of pushback against that. I did want to go back to this detention issue. You know, I have a client right now who is a gay man from Cuba. He and his partner came to this country because they were persecuted in Cuba for their sexual orientation. They came to this country to get married and, you know, live their full out lives. The one partner, he was transferred to York, Pennsylvania, and won his asylum case. We know asylum passage here in the 11th Circuit is at an abysmal less than 2%. So we're representing our client on appeal. He was transferred to Alamance County Jail in North Carolina, and they're planning to transfer him back to Stewart. And we've made a parole request that we're waiting on. I'm hoping to find out today or Monday. He doesn't fall into the category that Monica was talking about. He doesn't have any kind of conditions or vulnerabilities that would make him more susceptible to getting COVID-19. But, you know, talking to him about the conditions, at least even in Alamance County, there are 8 people to a cell where he's sleeping, no hand sanitizer, no gloves, no mask, no wipes, 15 people sharing a bathroom, very little soap. He has no criminal history. He was, you know, a music and dance teacher, an art teacher in Cuba. His husband when his partner got asylum, he came down to Folkestone and they got married in detention. And he has a community support. He has his now asylee husband, a sister-in-law who's a US citizen, a brother-in-law who's an LPR. So you would think, you know, hey, this guy should be, our parole request should be granted, but it has been such a struggle. And I'm thinking about that in conjunction with William Barr's memo, where he sent a memo to Federal Department of Corrections saying that people with criminal sentences should be released because of COVID-19 and finish their sentences at home. And so I'm just wondering, you know, what does that say that even for non-criminal detainees, these are civil asylum seeker detainees, why are we not seeing a similar allowance of these folks to go out of detention, be safe from getting COVID-19, and await adjudication of their cases?
Do you want my honest answer?
Yes.
This is my unfiltered answer, but it's basically because, you know, the detention centers aren't getting those directives from the federal government. And, you know, if William Barr can write a memo, you know, on, you know, the criminal justice population and not write something about the immigrant detained population, that says something. So for the past year, even before we had COVID, and it started with Jeff Sessions, there's been policy upon policy, you know, really taking away and limiting any rights, any legal rights that, you know, immigrants had. Asylum was one of those areas that was severely targeted over the last 2 to 3 years. And, you know, what you see at the border, what you hear at the border, but even what you see and hear here on a daily level has taken place. So if we don't have those directives from the federal government, the state is not going to do anything about it because that's not falling in their wheelhouse. They're going to say, we're going to do what the federal government directs us to do. And honestly, right now, the immigrant population has been that forgotten one. I think I've used the word forgotten maybe 4 times during this webinar, but it's the one that's forgotten. And maybe it's even further than forgotten. No one cares. And so this is the population that no one is going to go out of their way to grant any leniencies or anything towards to allow them to leave. So I think the directives have to come from the federal government.
Um, I wanted to, there were a couple other questions I wanted to get out before we open it up to questions in about 5 minutes. We were talking about, U.S. citizen children and children, the kind of families that are being impacted. I know the three of us have young ones at home, school age children. I have a photo of my son going like this on Zoom for his kindergarten classes. One of the top calls we're getting at Tahereh is children, parents not having access to things like tablets and internet, and the kind of, e-resources that are needed to participate in school. So how has COVID impacted the education of these children of vulnerable parents, and what are kind of the calls that you're getting around education?
Yeah. Yes, the community lacks, what is needed to effectively participate in online learning. Not only its tablets, there have been some efforts from companies, right, to provide hotspots and internet, but they don't have the tablets. Oftentimes they live in crowded quarters, several families, or, a numerous family sharing 1 or 2 rooms. So there is definitely not enough privacy, all the recommendations, social isolate, go to a corner, focus on your work. They can't do that. A great area of concern, Shelly, in addition to that for us, and we have placed a call to Superintendent Woods in Georgia, it's that there have been no efforts to ensure that English learners continue on their journey to proficiency for the language. So, if you don't understand English well, your parents don't speak English well. And let me tell you, this is not just a few people. There are 1.5 million people in Georgia that speak English less than well. So when you have all of these parents that cannot help you with work, and children don't understand something and don't have a tablet, how are they supposed to learn? And so, under, in 2015, ESSA, right, was passed bipartisan. These allow great flexibility to the states to provide programs and support to English learners. And so one of the projects that we have currently is understand what can be done and what has been done to ensure that these kids are not left behind. Because at the moment they are, and it's thousands and thousands of them in Georgia.
You're right.
And then I guess my last question before we turn to stories, I mean, I think you've heard the three of us talk about being undocumented versus a term that we hear a lot, which is illegal. And I know one of my mentors when I was at Georgia Legal Services, Lisa Kreischer, said the term illegal is legally and factually inaccurate, because a lot of the folks here who are out of status or don't have status may qualify for status. And organizations like Tahereh and GAIN are helping immigrants obtain status. Monica, I'm sure your pro bono attorneys and you and ULPA have been following EOIR and when courts are opening, when courts are closed. I mean, I know for, in civil litigation in the state and federal government, courts are closed. You're getting continuances passed. Is that happening? Are you seeing that happen in immigration cases, or are you having to move forward with deadlines?
So yes, I mean, there's been some allowances on some filings, but it's not, even keel spread across the board. It's, you got to check in, see, what courts are open, but also we know that for detained cases, they are moving forward. Even for some motions that we filed, we haven't heard back to maybe move, something ourselves, or, check in on something, change attorneys, whatever it is. The courts are overwhelmed right now. The immigration court systems they were already overwhelmed, let's be honest, with all these policies happening. So when COVID hit and you're having to redirect and change around, the administrative offices in the courts are overwhelmed, and they're trying to do things a webinar like we're trying to do. And so it's been haphazard everywhere. There are some cases that have been moving forward, others that haven't. And some cases we need to move forward. For example, an asylum case that, you know, might be eligible for work authorization, but the case has been stopped and it can't be heard. Well, then, you know, our client then can't move forward and is stuck in this world where they can't access, you know, work authorization. They can't get a social security number. They can't drive. What happens to that person? They're more vulnerable to some of the evils that are happening in the world, like human trafficking or deportation. And, you know, that, well, you know, places our clients in an even more vulnerable situation when courts are not moving in a consistent way.
Right. And I mean, I remember when I joined Tahare in about a month and a half ago, and I went to immigration court, and that was when, you know, COVID, and we were all getting instructions about washing our hands. Immigration judges were told to take down the CDC signs regarding, you know, how to social distancing and hand washing. And in fact, you know, some immigration judges up in New York have caught COVID-19, and there's really not a push, not even to, let alone immigrants that are going into court for their cases not having protections, but even workers in these court systems not having protection. And so, what does that say about the immigration system in a time of crisis?
Yeah, no, you're absolutely right.
And then I know we have a couple minutes before we can, one topic that we wanted to address is the vulnerability. I think you brought this up earlier, Monica, but you know, a lot of the clients you deal with are victims of domestic violence. How is this time kind of exacerbating that, especially for this vulnerable population?
No, and thank you for bringing that up, because I really wanted to hit upon that as well. We hear all these news articles, you know, about domestic violence increasing, you know, during this time. And I really want to make sure we hit that point home, because if you look at it from a just, you know, rational way, well, you know that when families are locked together, when they're isolated from any type of help, when there are financial stresses and burdens and housing instability, you know that, the pressures, you know, are going to probably be motivated into more domestic violence. And so I want to make sure that I get the point across that our immigrant community is already in a vulnerable situation. They're not, and I think I've used the word vulnerable a lot, but they never felt comfortable or, you know, believed that they had access to law enforcement. You know, sometimes we have to convince our, our clients that law enforcement is on their side because they don't believe it. And so in this time with the financial stress, with being locked in one room, not being allowed to see others, not having an outlet, you know, kids don't have school to go to, families don't have jobs to go to, you know, that might have been our clients' only outlet to go to work. And if that's taken away from them, you can bet that they're in a more desperate situation. And so, you know, I'm more worried about our clients right now. In France, they came out with a statistic that domestic violence has increased by 30%, and that's only with the reported cases. So you know that it's a lot more. And I, you know, bet that we're going through the same thing over here as well. The shelters, you know, maybe are shut down because they are, you know, afraid of COVID. So they're not accepting more people. So this population really has nowhere to go during this time and no way to ask for assistance.
Thanks, Monica. I know this is one of the questions and that I see in the chat, and I think a lot of our listeners will want to know: is there something that members of the public can do to support this population, whether it's victims of domestic violence or their children needing access to education? What are some thoughts you have in terms of what our listeners can do to support this vulnerable population?
I think they can do several things. One is that if you have a neighbor that speaks a language other than English, help them out. there is very limited access to languages other than English in Georgia, even for basic information. Utilities company put out information, right? All of these measures by different governments, very few are in language, particularly in languages, for example, from the Southeast Asian community that I know Aparna is on the line. I want to make sure that I bring her point because it's just lacking. They can write a check. There are numerous funds, emergency funds that are half open to help the community. I'll encourage you, support those funds, provide your dollars if you can, as directly as possible to the communities that are most vulnerable. Pick organizations that are run by people of color, by immigrants, by women, by the LGBTQ community. Trust that it is our communities that have the best interest in our communities. You can also advocate. We can, like Monica said, our communities are invisible, to some of the decision makers. We need to make sure that we are no longer invisible. This is not something that only us can do. This is all of us together doing it, because at the end of the day, all of our lives are interconnected and intertwined, right? It is all of us together.
That's exactly right. You'll always have me, Gigi, Shelly, others in the community. I see my good friend Aparna, who's on with us, and she'll always be there as well. And we'll always be there to advocate, but we need a larger population to advocate with us. The other thing that can be done also is really donating. Gigi, you said that we're all having client emergency funds that, we're setting up. Gigi has, been giving, the figure 200,000. That sounds like a lot, but it's really not when you're dealing with this population who have so many needs and have nowhere to go. And so we would love, any support that we can that's going directly to the folks that need it. That's not coming to the organization, but going to the folks that need it the most.
Yeah. Can I say something else?
Yeah.
Okay. I know that there's also a lot of people that are interested in organizing, right, and creating their own, efforts to support the community. When you do, because this is also extremely important, it's the time that, it takes all of us, like I said, to, mitigate the situation. Don't ask for IDs for people needing food. Nobody that is hungry, right, it's going to make a line, go out and ask you for food if they don't need it. People need to eat. Don't ask for an ID. A lot of us don't have it. Don't ask for children to be present. Children are safest at home. If you have a drive-through model to give out food or emergency supplies or tests, know that is by design, excluding everybody to own a car or to be able to drive in Georgia, which is all the undocumented community. You're asking them to break the law if you want to get services. So again, language access. So think about, us, right? As an immigrant, in Georgia, as a, somebody that learned English, think of us when you design your programs, because if it's not by design, then you are effectively excluding us from receiving your services. So that's all.
No, and thank you for saying that, Gigi, because I've heard of some food banks asking for social security numbers. And I know that the food banks, it's not because they want to deny services, it's because they need to keep their data, of who's coming, and a social security number is an easy way to keep data. And their purpose is not to deny to undocumented. So really spread that word too, because, I don't think some food banks understand or realize that not having a social security number is a barrier for many of our clients, and they may feel like they're not receiving services as well.
Right, or they might, if they get wind of that, might not want to go because they're
Right.
like, well, am I going to be vulnerable? Is ICE going to be there? As soon as word like that gets out.
Yeah, and if they don't have a social security number, I think explaining that and making sure that they can, is there another information that they can give, like their name, or if they're not comfortable with that, something else that they can give instead.
One of the questions we have in the chat is about, we were talking about the federal government needing to kind of give a directive regarding detained immigrants. And one of the questions is, what departments in the federal government, how can we help, and what can we do to voice it over to the federal government?
Yeah. Like Gigi said, advocacy, really getting that out there. I think that the departments that need to do something is the Attorney General. If we can, have luck in getting a hold of him, but also the immigration departments and, other federal institutions that work with our immigrant population, which probably would be the immigration departments and EOIR. They're the ones that need to hear. And we do have advocacy happening. We do have some national organizations who are positioned to do this really well. And so I don't want to give the impression that it's not being done, but I think that, the more voices that are heard, especially from a population that they may not expect, is, important. I said this before, you all expect me, Gigi, and Shelly to be doing this work. Others who are on this webinar are doing this work, and you expect us to, but it's really those unexpected whose voices are sometimes heard louder.
Right, right. Yeah, no, I mean, AILA, the Association of Immigration Lawyers, has been sending letters to DOJ, which is the executive department that houses, immigration court and detention facilities, saying, that this is, I think the healthcare professionals have been saying this is going to be a hotbed for infection and for illness.
Yeah.
And has been begging for release.
I think SPLC and ACLU both have been filing, class action suits as well.
Yes.
With the assistance of some of the Atlanta law firms.
Yeah, triple Asian Americans Advancing
right.
Justice and SPLC, along with Kilpatrick, I think, filed a class action habeas to get immigrant detainees who are vulnerable, like Monica was saying, who have illnesses that make them more susceptible, to get them out. But again, that's one layer. There are a lot of people who, are healthy and could leave unhealthy. So I think that's another point. We have a question from Lynn, Massachusetts. She said, this is Cleo, who says that there's a significant population of unaccompanied minors from Central American countries. Is there anything specific you are seeing in Georgia in regard to work or access to education for kind of unaccompanied children that are in the state?
And anything positive?
Yeah.
So Gigi did mention, some of the hurdles that a lot of children are having. And there's this amazing organization here in Georgia, KIND, Kids in Need of Defense. And they work with the, unaccompanied minor children population more than we do at GAIN. We work with the adult population. But I know that they have been, KIND has been inundated with phone calls, and they've been inundated with a lot of requests. So I don't know if, Georgia and Christina, who is the director of KIND, could, definitely provide more information. I don't know if there's anything really positive or amazing that Georgia has been doing for children, especially if they're unaccompanied. I think a lot of what I said earlier, applies to them, as well.
Yeah, I do know, and I was talking to Roy, their, social services worker, at KIND, right before the webinar, and he was saying they were calling each one of their 200 clients to make sure that they had food and see how they could provide tablets and everything. So I think there's a lot of great work being done by community organizations and by volunteers.
Right.
But you're also part of Georgia, just not the bosses of Georgia.
Which is really wonderful to hear that the community, members and organizations are filling that gap, because it's not coming from the top. It's not coming from the state. It's not coming from the government. It's coming from, the community organizations. And for, any organization to call 200 clients to see what they need is really amazing. And that's, the great work that's being highlighted by the organizations.
We have a question from Aparna about, what can be asked of folks that are seeking access to food banks or other kind of workshops and resources that are available other than than Social Security numbers?
Yeah. So I think we as, organizations need to do more advocacy on that. I know I've been doing a little bit with some food banks for our clients, because it's hard for our clients to go ahead and advocate, right? To say, okay, now you go to the food bank and you advocate for yourself. I think we're the ones that need to actually bridge that gap for our clients and come up with a list. I know at GAIN, and we've been working with other organizations as well, our social services, our navigators have been putting together a list of resources and have been trying to bridge that gap. And so if you reach out to me, Aparna, I know how you know how to find me. We can help you with that.
Yeah. I think that, also being open to receiving other types of identification, not from this country, but still picture ID. So passports, matrícula consular, some other type of ID, it's important. Oftentimes students have a student ID from their schools, that shows that they are, Georgians and that are going to school in Georgia. So that's another option.
Another question we have is, and I know we're at time, so maybe we can end this way of what are some things that we see in other states? What policies or state legislation is there in other states to help this vulnerable population that we would want to replicate here in Georgia?
Yeah.
I'll give 3 ideas, and Monica, I'm sure will have more. One is that, other states have expanded Medicaid. So there is more people that are not falling through the gaps and are able to receive health services and testing and treatment. There is an opportunity to do an emergency expansion in Georgia, but, other states have, allow, driver's licenses, again, not just for COVID-19, but throughout the year. People need to go to the hospital, to school. The state can also decide to start issuing, providing information in languages, not only in English, which is, the official language of Georgia, and that's the reason why they are not providing enough information in other languages. They can also, set up a fund and make sure that they provide support to, immigrants and expand the support, the financial support that they are providing. A lot of cities, have the capacity to do this. It's just the will.
That's exactly right. Gigi, you said it best. I know Minnesota, their state, put together a fund for undocumented clients. So we really need that leadership from the state, and from our city even. I know our city cares. I know that there's a department within, Keisha Lance Bottoms, office, and I know that they really care. But if we could have funding, if we could have, state authorized legislation to create that funding, that would give a big message.
Well, I want to thank both of you for this, very lively discussion. I feel like we could keep going. I know this is a part of a series that the National Center for Civil and Human Rights is putting together. So I want to turn it over to Cameron, who's going to talk a little bit about some upcoming events that our listeners can participate in.
Hello, everyone, and thank you so much to our panel and our wonderful moderator. That was a wonderful discussion, and I'm so glad I got to listen to it. We do have some great upcoming events. One is a training presented by our center's education department, and it's called Freedom Mosaic, Individual Stories That Transformed History. This is something on our website. It is a great tool, especially for those parents teaching civil rights at home as the parents have become teachers. Another thing for kids is our Spark Lit Club. Next week's story will be 3,585 miles to be an American girl. So please come check that out on April 16th at 10:30 a.m. We're also starting a new program addressing mental health disparities. And here is the lineup for that. There will be a number of series on this, working with our institutes as well. So be sure to check those out, and those will most certainly be on our website. And also, Shelly had mentioned the trip that the center and other organizations took to the border. That video is up on our website under our events page where you signed up for this webinar. So please check that out. It's a very telling story. Thank you so much for joining us today. I hope all is well and you're being safe. Have a wonderful day.
Thank you, everyone.
Thank you.
Thank you.